Welcome back to Toledo Clinic Television. Our guest for this segment is Dr. Lawrence Monger, an internal medicine specialist. Thank you for being with us.
Thank you.
We talk a lot about treatment in medicine, but there is, obviously a huge body of evidence that talks about prevention and staying healthy. And one of the ways to do that is through vaccines and flu shots.
Yes.
So let's begin with flu shots. It's that time of year.
It is.
What do we need to know about them?
Get them, first of all. Whether you come to your doctor's office and get the flu shot, you go to any pharmacy and get the flu shot, it is so important to get your flu shot. And flu shots change from year to year. The formulation changes, so it's important to get the new flu shot when the season starts to come along. And it makes all the difference in the world in how ill you might be if you're exposed to the flu, whether you get ill at all, and whether you are hospitalized or not. Some people who don't get flu shots get ill enough that they are hospitalized, and unfortunately some people don't make it from influenza, so it's important to get your flu shot. And especially for older patients. There's a formulation that's separate from the regular flu shot for most adults that is a higher strength flu shot. And so for certain older patients, certain patients who have other medical problems, it's important for them to get the high dose. So please talk to your provider. At this point, pharmacies also offer them. I prefer they come and talk with me about it because it's something that's important to talk about as a primary care provider, but it's just important to go and get your flu shot and other vaccines as well.
And so as you get older, then are you talking about pneumonia, shingles, what kinds of?
Yes and yes. I mean, there are pneumonia shots that are appropriate. There are complete guidelines that we follow on certain ages and certain comorbidities as far as what shots you need, as far as there's 2 different types of pneumonia shots that are important to talk about with your patients and spacing those out appropriately. If you had chicken pox as a child, shingles is a horrible recurrence of chicken pox, and it's just very painful, and it can cause pain for months and years after an outbreak of shingles. So there's a great 2-shot vaccine that prevents shingles from occurring. And if we can prevent shingles and prevent that pain that happens with that outbreak, it is so important to get that vaccine. So that's another very important one.
What do you tell your patients who are concerned about potential side effects from vaccines?
I tell them that they've been very well studied. All of these vaccines I've mentioned have been incredibly well studied, and other than your immune system reacting to getting the shot initially or having a little bit of redness at the site, that people do really well with these. And so I don't have, these are vaccines that at age appropriate I will take, and I have given them to my family, and if I'm comfortable enough with them and with their safety that if I'm going to give it to my family member, I'm going to suggest it to you. So,
are there other vaccines that we need to be thinking about on a regular basis?
Well, we're in the age of COVID, and you really have to consider getting your COVID booster right now. There's a bivalent COVID vaccine that's available that for these latest Omicron strains that is very effective at preventing hospitalization and illness and death in the hospital. So, and the other part about these latest strains is that you can get the COVID virus more than once. And so it's important to try to protect yourself from getting it and getting all of the side effects. People don't, I think people recognize and hear this on TV all the time, but beyond being sick and being hospitalized or having pneumonia from COVID, it can affect the heart. It can affect your sense of smell. There's so many things that we're finding out about. There's a whole literature now on long COVID and what COVID viruses do over the long term. So I think if you can prevent yourself from getting the disease, or you can lessen its severity with a vaccine, then please do so.
Is that something that we need to continue to be aware of? Because we like to think that we're emerging from COVID, but that really is not the case.
It's not the case. I see patients every single week who are positive for COVID. It is still with us. It is a virus that will be around for quite a while, if it will, as all the other viruses are, including flu, and we have to live with it and deal with it. So I think it's important to continue to be aware of it It has not gone away. It is still with us, and it will continue to be with us.
All right. Thank you so much for being with us.
All right. Thank you.
And thank you for watching.